Getting back to indigenous foods, it's there's so many benefits to it. There's health benefits, there's cultural resiliency, and it's building community. When we do different potlucks, people can come together and visit over a meal. There have been, I don't even want to call them studies, but there have been different food summits that I've attended. And Dan Cornelius with Intertribal Ag Council had said that when people are eating, like there may be people that are diabetic or pre-diabetic and that have come to eat at or have attended the food sovereignty summits, they've been able to like check their blood sugar and their blood sugar's gone down or their blood pressure's gone down. So there's something to be said about we are what we eat. If we're getting back to not what our grandmother ate, but what our grandmother's grandmother ate, we can start getting back into what's good for us, and what was intended for us. We all have different foods and different food sensitivities, but being able to fuel ourselves will allow us to keep going on. And there's so many elders that we've lost along the way because of their food, or I don't even want to say their food choices, but their food options. Their food options were limited, and yeah, we've lost that. But when we do remember where our food comes from and what we're eating and how it's processed, we can all share that together and focus on building our culture back, bringing different ceremonies back, because we don't have to worry about all the health stuff on the sidelines. It's definitely a part of everybody's job. We all live on Earth, so we're not only part of the problem, but we're also part of the solution. So what can I do to reduce my footprint, not only as an individual, but as a family, as a clan, as a tribal member? I think we've gotten so far back where people think that it's all on the individual. One person has to come up with a solution, and that's not true. In my experience, we had somebody from each department because we all came to the table with different skills. And we also came with different perspectives, but also different life experiences. And I think if we all came back around the table again, we come up with some really good things or really good solutions, maybe not for ourselves, but we need to remember that everything we do today doesn't affect us, it affects our future generations. And getting back to that, if we're focused on them, we're probably going to come up with some really good things, and really be able to move forward and preserve our culture and be resilient in these changing times.
Our children and families have a lot of stressors in their life, so I think there's challenges with the amount of stress. Do they have homes to live in? Do they have food on the table? Do they have a job? What's money like? So there's a lot of things that build into stress in their life, and Head Start tries to address these programs because it's a holistic program. It's through Health and Human Services, so it's not just the education of the children, but family services. Is the family taken care of? Because if the family's in a good spot, then the kiddo's in a good spot. And then a whole range of health, nutrition, and safety services, which I'm kind of in that umbrella with. So, our goal is a healthy child is a better learner. So how to get that child healthier to a healthier point, and then support the families to keep things going on a positive note.
I think the biggest challenge we face with the health needs in the future, I don't see them to be a whole lot different than what they are today. I do envision that with the critical mass that we have now of people that are motivated to change and improve lifestyles, that this continues to grow. And we have more focus on wellness and health rather than dealing with this illness-based model. So I see that to be more more of our resources would be going towards wellness and health rather than trying to fix what's broken. I see that growing. I also see us gradually moving to a more healthy place as a community. Community's got several issues that Debbie alluded to previously in terms of intergenerational trauma, which reflects in poor choices with the healthcare choices that folks make, or lifestyle choices, including addictions and other social issues that we deal with. I see increased awareness. We've got multiple seminars, outreach events, and educational events that are addressing those issues. So I see that to be on the forefront, tackling those issues at a much more root cause level than just trying to fix things that are broken. I see in terms of our needs growing in the healthcare field, but more in the public health arena and wellness, and hopefully shrinking in the illness realm.
So there are many tribal clinics that offer traditional healing services within their four walls, which is wonderful. And there are other examples of sort of external support of people, so like really extending that care that's given in the healthcare setting to people's homes, and it's been very successful. And research has demonstrated that when people feel tied to nature, feel tied to self, and their health outcomes are much better. And there are many communities that really buy into that and really, support cultural activities, and not because the research says so, but because they know that it's effective in keeping people healthy.